And the third wave of COVID is here. Mumbai is struggling with over 20,000 daily cases, but government-run hospitals are witnessing low influx of patients as compared to the private ones. 60% occupancy in private hospitals, and the civic body-run hospitals have seen an occupancy of 16.8%. Here is a report why.
The maximum city is in the grip of COVID yet again. With daily case count rising sharply, the city has breached the 20,000 mark. The only silver lining for the government is the low level of hospitalization.
अगर हम दूसरे वेव से कंपेयर करेंगे तो दूसरा वेव में बहुत स्पष्ट ये चित्र दिख रहा था कि कई बेड्स उपलब्ध नहीं हो रहे थे। मुंबई के सभी हॉस्पिटल्स फुल थे, लेकिन बेड अवेलेबिलिटी में अगर आप देखेंगे तो 10 to 15% बेड्स ऑक्युपाइड है। इसका मतलब है 80 to 85% बेड्स अभी भी खाली है।
As on 6th January, the BMC COVID data reveals that only a fraction of the more than 35,000 beds were occupied in BMC-run hospitals. While the BMC-run hospitals are seeing low levels of hospitalization, the private hospitals are seeing a rush. Nearly 60% of private beds are occupied. Dr. Lancelot Pinto of PD Hinduja Hospitals contends that this is because in the initial stage of COVID waves, patients admitted for other ailments stayed longer after testing positive.
शुरुआत में बेड्स इसलिए भर जाते हैं क्योंकि लोग किसी और चीज के लिए अस्पताल में आते हैं, हार्ट अटैक के लिए, स्ट्रोक के लिए, किसी सर्जरी के लिए, और वो पॉजिटिव निकलते हैं। और क्योंकि वो पॉजिटिव है और हॉस्पिटलाइज किसी और कारण से उनको घर नहीं भेजा जा सकता है, तो उनको कोविड वार्ड्स में रखा जाता है। तो शुरुआत में वी आर गोइंग टू सी अ लॉट ऑफ दिस कि बेड्स आर ऑक्युपाइड, द ऑक्सीजन यूटिलाइजेशन विल बी लो।
In Mumbai, there are 142 private COVID hospitals. Out of the 7,500 COVID beds in these hospitals, 4,500 are already occupied. Dr. Gautam Bhansali, who coordinates with all private hospitals for COVID, says that all 102 beds in Bombay Hospital are occupied as on 7th of January.
The main reason behind this is that maximum cases which are coming in Mumbai is from the high-rise building. That's why there is a little bit load on private hospital. Yes, we have an occupancy of, you can say, 60-70% beds are occupied. 60% beds are occupied in the Bombay in private hospital. Rest of the beds are still vacant. So, but there is not that much load. But yes, number of that occupancy is increased.
At present, the count of active sealed buildings in Mumbai is more than 500. The BMC seals a building when more than 20% of occupied number of flats is affected with COVID-19, and at least 10 COVID-positive cases are detected in these affected flats. Experts say that one would need to wait for at least a week to see the real spread of the variant.
I think it's a little early क्योंकि कोविड का सर्ज अभी हो रहा है, तो एक हफ्ते बाद हमको बेटर पिक्चर मिलेगा कि बाकी शहर में क्या हो रहा है, कितने लोग इन्फेक्ट हो रहे हैं।
It's a fact that bed occupancy in private hospitals is increasing, but the oxygen utilization is less. The big question remains, what is going to happen in the days to come when the COVID situation is going to deteriorate and the demand for COVID beds is going to increase? With camera person Samir Shanbag, this is Pankaj Upadhyay in Mumbai, reporting for India Today.